Time now for Morning Rounds. As we've been reporting, a mass exodus of residents has managed to flee the approaching Hurricane Irma, but many more remain in its path, of course.
Aside from immediate safety concerns, there's the issue of maintaining health during and after the storm hits. Here to talk about this is CBS News contributor Dr. David Agus. David, good morning.
Morning, Dana.
We obviously talked about this in relation to Harvey and the flooding, but when you go to Florida, we don't even know what's coming next. You have a lot of elderly residents. What do you need to have on you if you've got some of those chronic health conditions?
So there are a couple principles. One is get all of your medical information and try to put it online. So put it into Dropbox or somewhere you can access it. You're going to be somewhere apart from your doctor. And by the way, your doctor is also fleeing, so you can't call him or her. So that information. And take 2 weeks of your medicines and put it in a Ziploc bag. Don't let it get spoiled, but take 2 weeks. Don't take a day or 2 days.
Right.
Take a long amount.
David, in Texas, they've announced they're conducting aerial mosquito spraying because of Harvey. Are we going to have the same thing in Florida, and how serious is this?
Mosquitoes love stagnant water, and so classically, days after this, mosquitoes start breeding, and mosquitoes obviously Zika, West Nile virus, so we worry about it. Spraying works. It's spraying chemicals, so obviously there's dangers to us. We're told that the dangers of the mosquitoes are much greater than the dangers of the chemicals. But this is going to be a big issue, especially in Florida, where Zika was really prevalent over the past year or so.
It may be too late for people to start gathering food, water, but going ahead, what do they need to keep in mind when it comes to food and water in Florida?
So obviously, lots of food, lots of water, and if you're staying there, one of the things you can do is take a coin and put it in your freezer on a frozen glass of water, and then if you come back and that coin's at the bottom of the glass, you know your freezer thawed and that food isn't any good. And so, food spoils, and there's going to be a large period without electricity that we have to be aware of.
So you need to watch out for that. One of the things that concerns me here is, you mentioned a lot of doctors are leaving, people are leaving. If you need to see a doctor in Florida, what do you do?
Well, the emergency room is going to be closed. It's going to be very difficult. But the telemedicine companies have all stepped up and said, you can use telemedicine for free. So if your cell phone works or you have a computer or you're someone from Florida who's gone up to Georgia, you can talk to a doctor on these services and they can give you advice over the internet, which is really great that these companies have stepped up. When Harvey happened, a friend of mine, a doctor in Texas, called me and said, I'm fleeing with my family. Can you talk to my patients? And I had a whole list of patients to call and talk to for him. Yeah. So everybody needs to step up.
We talked about this also with Harvey. Obviously, this is a huge stress on people. There are, mental health concerns that go into this as well.
No question. We see it in all of these storms. You get mental health issues become prevalent. And it's stress. You're not sleeping. You're worried. So we all have to take care after each other and look after them. And family members, call your families from Florida, talk to them, and try to settle them down. We all have to work as a team.
All right. Dr. David Agus, thanks very much.
Thank you, guys.